Good morning, good morning, Shalom, Halatoshitoras, Hubi, how are you? Welcome to the first world webinar of the European Laser Academy. Thank you very much for joining in. I'll try to give the basic informations about the recent achievements and a view back to the history of photobiomodulation of low-level laser therapy that has been performed over the last 5 decades under clinical conditions. Well, myself, I'm a Western trained medical doctor. However, from the very beginning of my medical career, I was looking out of the pot. I always realized that in acute conditions, what we learn in medical school is outstanding, but in chronic conditions, we need to find other ways of supportive methods. And what I will present to you is nothing esoteric, but is really an integrative concept of integrating photomedicine, mitochondrial medicine into our daily clinic based on a scientific background. I've been performing LLLT, as we used to call it, low-level laser therapy, for more than 3 decades. And nowadays, I'm mainly working on photobiomodulation in combination with mitochondrial medicine. Well, let's start out what's all is about. I will give you a short introduction. What's light? We will talk about the cellular effects of photobiomodulation and the subcellular effects. The main target, the main antenna pigments for photobiomodulation are the chromophores on the mitochondria. However, there are others as well. We will have a short look. It's only an introduction. What can laser do for stimulating, for healing processes? What can laser do for pain management, for wound healing? Few indications in dermatology and cosmetics. Few informations about the huge variety of indications in urology and gynecology, some basic information how laser can work in internal medicine. If we combine the power of light with what we call photosensitizers performing photodynamic therapy, we can use the laser successfully even to combine to treat cancers. And according to the new guidelines, laser light could be an outstanding supportive method in chemotherapy and radiation therapy induced oral mucositis. And one of the absolutely fantastic indications for photobiomodulation are the neuromuscular diseases, are orthopedics and cosmetics. Well, you already see in the cartoon on the upper part, one of my most beloved tools, the so-called superpulsed cluster probe. Now it's working. It's a fantastic tool for bring a high amount of photons in a painful area to enhance wound healing processes, to penetrate into the bone. It goes perfectly into the bone. It can penetrate the skull bone. This is a terrific tool you will see several times during this 2-hour lecture. Well, one of the basic principles of photomedicine is without light, there wouldn't be any living on this earth. In all big religious, all over the world, the light has an important place. We know without light, the plants couldn't grow. Without the growing of the plants, the animals wouldn't be fed, we wouldn't be fed. And for millions of years, nature has used the power of light to let grow. And this is one of the principles of physics. Energy never can be destroyed. Energy only can be transformed from one form into the other. So sunlight would be kinetic energy that is absorbed by the plants. We all know about photosynthesis. And the plants transform the power of light into structure they let grow. And these photos I took 2 years, 3 years ago around our ranch we used to have in Germany. Crops growing within 2 weeks from this size to a plant like this. Wow, this is the power of light. This is what we shall be talk about. Well, to all of us, very well known is the fact that the plants have antenna pigments, have chromophores to take up the power of the sunlight and let grow. And our powerhouses, the mitochondria, have a very, very similar structure to the chromophores of the chlorophyll. So our cells can uptake the different colors of the visible spectrum, the colors of the rainbow as well, to induce healing processes. The chlorophyll has two main absorption peaks, one in the blue light, very short, powerful. The shorter the wavelengths of light, the more energy, and a peak in the red and infrared. And we will especially focus on red and infrared irradiation. What I'm talking about is not an esoteric thing. It's high, broad evidence. It was more than 50 years ago that photobiomodulation, LLLT, low-level laser therapy, as we used to call it, was brought into medicine. Ever since, we have a huge increasing number of scientific publications. In 2014, at a conference of the world, we decided to change the term of LLLT, low-level laser therapy, to photobiomodulation. Therefore, there seems to be a drop of publications, but if you put in Google any disease, photobiomodulation, LLLT, you will find hundreds and hundreds, maybe thousands of scientific publications on this topic. One of my last publications was the power of light. For example, the power of the superpulsed cluster probe, bringing all together with the 5 flexible tips, fantastic device that fits to everything. We irradiated with this device, or with a Lightstream class 4 laser, we irradiated, according to publications from Yuri Uron, over the tibia bone bilaterally with a maximum energy density of 600 joule. And we could demonstrate that we had an outrange of circulating stem cells, of mesenchymal stem cells. Original paper by Yuri Uron, 700%. Imagine 700% within 1 hour increase of circulating stem cells. With this method and with this tool, over the whole long bone, not only over the tuberositas, we achieved an increase of circulating stem cells of, in some patients, more than 1,400% within 1 hour. What a capacity for healing processes, for well aging, for better aging. We want to age. I don't like the term anti-aging, for better aging. Well, there's an English summary. If you're interested, I can send you the original paper on this topic. Well, what's light? We can't see light. We only can see light when it hits a surface. More than 200 years ago, Sir Isaac Newton said light is a wavelength. And that's true. Light is an electromagnetic wavelength, like X-ray is, like ultrasound is. All these are electromagnetic wavelengths. But at the same time, then this Albert Einstein is the theoretical inventor of the laser. He said at the same time, light is a small particle. Light is a photon, consists of photons. In 1960, the first laser devices were produced. This was a real breakthrough. And only a few years later, all the honor goes to Professor Andre Meester from Budapest, from Hungary, who detected the healing effects of laser. He could show by irradiating defect tissues, non-healing wounds in cancer situations in small animals, that it was an outrange in healing processes and we will go in wound healing very briefly in this presentation. This is one of the most fantastic things or well-described facts for photobiomodulation. Well, several times already I used the term laser. What's laser? Laser is only an abbreviation. Light amplification by stimulated emission of radiation. So photons are enhanced. Light is brought to a higher energetic level. The laser means the photons are brought into a parallel beam, and the beam is brought in phase, and this is what we call coherent. So laser light means light of one wavelength with coherence. And you see in the picture the different colors from transdermally for transdermal irradiation of tissues, for acupuncture purposes, for example, as well. We only can use visible red or non-visual infrared light. If we want to use photons in tennis elbow, in golfer's elbow, in mastoid problems, in hearing loss, in tinnitus, and irradiate transdermally, we have to work with visible red or non-visible near-infrared light. But there are certain situations where we do want to work with other wavelengths as well, where we do want to work, for example, with yellow light irradiation. When we want to regain nervous structures, then we would need, for example, yellow light irradiation. It's good in depression. It's good to enhance the production of serotonin, enhance the production of vitamin D3. So in certain indications, we do need other wavelengths for the treatment as well. What's laser? Light of one wavelength, in contrary to the sunlight, to the light of the bulbs, which contain all the different colors of the rainbow. Laser light is light of one wavelength, and it's brought into higher organization, and this is what we call physically coherent. Monochromatic, one wavelength, coherent laser. And this is a unique form of light. Where can we perform photobiomodulation? What are the effects of photobiomodulation? What is the effect of LLLT, of low-level laser therapy? We use a non-ionizing source of photonic energy that generates, in the class 3B laser, a non-thermal therapeutic effect. X-ray, gamma irradiation is an ionizing effect on the tissue, gamma irradiation. Very, very, very short wavelengths of electromagnetic signals are used to treat cancer situations, but photobiomodulation means use the visible colors of the rainbow, the colors along which all life on this earth is constantly growing. Photobiomodulation, non-ionizing. And the fascinating thing is, low-level laser light can perform both. On the one hand, it inhibits negative processes. On the other side, it promotes positive healing processes. If I give a relative high number of photons, I have a significant pain relieving effect. I can block the C fibers. And I reduce at the same time inflammatory processes. And at the same time, I have many promotive positive effects, such as effects on wound healing, tissue regeneration. I enhance the building of fibroblasts, of elastin, of hyaluronic acid. I can boost through the immune system, and I can even, as I mentioned just before, can activate the stem cells with, for example, the terrific 5 fingers super pulsed cluster probe. If you look in the literature, you will find many terms. You may find cold laser or soft laser. Nowadays, until 2014, as I mentioned before, we mainly talked about LLLT, low-level laser therapy. Since the consensus conferences in Arlington, Washington, and in Nice, in France, the world decided we would like to change the term to photobiomodulation. So everything means the same if you find these things in the literature. Quite often you do find on the market devices that claim to be laser devices, but they are extraordinarily cheap. And then there will be LEDs. LEDs is close to one wavelength as well. It's not that narrow in the wavelengths as the laser is. It can be used for photobiomodulation in certain indications, but it's different. It's not coherent light, and it's not that small wavelengths window like we have in the laser. Here you see the Photon Care Germany device, Moonlight and Starlight, with red light irradiation. We will see the different colors in a few minutes and the purpose of it. Laser, very short wavelengths, clear color. This is shown in the left part of the curtain, monochromatic one wavelengths. Just to make sure for you what is electromagnetic wavelengths. Our human eye is not able to see UV light from the sun. Our human eye is not able to see invisible infrared light. The cell phone can. The cell phone can see infrared light. Electromagnetic light is, as well, as I mentioned before, the X-ray. You see it by the X-ray of the hand, and the warning sign for gamma irradiation. All these are electromagnetic wavelengths. The shorter the wavelengths, the higher is the ionizing effect on the tissue. Electromagnetic wavelengths is, as well, the radio wavelengths we have. We are talking today about using of light, of the visual spectrum of the eye, using the colors of the sun, the colors of the rainbow. In 2014, I was invited to lecture on the World Conference in Washington, Arlington, and the ceremony speech was given by Tine Karu, an Estonian photobiomedical or biological researcher. In the 1990 to 2000, she published hundreds of scientific papers on the effect of red and infrared light irradiation. She focused especially on one of the most important antenna pigments for transdermal irradiation, on the complex 4 of the respiratory chain, on the copper-dependent cytochrome C oxidase. And I 100% agree with her. In the opening speech, she said, it's time to call photobiomodulation as drug equivalent. Or maybe I would even change. I would say it's time to call photobiomodulation in certain indications as drug superior. Quite often, the use of light is an integrative approach, but in certain situations, it can be the leading therapeutic approach. Cells communicate with light. Cells communicate with ultralight, with ultra weak laser-like impulses. So the history of light begins with the creation. We are all living rainbows. We all demand, as well as the nature on the power of the sun. And the photon care Germany device, the moonlight and starlight device, can offer all the different colors of the rainbow and can give it with a very precise resonance if desired. Once again, this is what nature shows us. This is what nature teaches us. Energy never can be destroyed. Energy never can be created. Energy can only be transformed from one form into the other. And this is what we see when the rainbow occurs. This is what we see when we look outside and see the growing plants. What are the different advantages and disadvantages for laser, for the different colors of laser, for the different wavelengths of light? We can use basically all colors of light for treatment, sometimes even violet irradiation. If we work transdermally, if we do not want to insert a needle into the bloodstream, into the tissue, interstitially, intra-artically, then we only can work with visible red or non-visible near-infrared light. Only red and infrared gives a good penetration of photons down into the tissue. One of the great wavelengths, for example, is 808, 810 nanometers. Near-infrared light, near-infrared gives a bit better penetration than visible red light, would be 650 nanometers in example. So for transdermal irradiation, red and infrared. And you see in this cartoon, if you are a dermatologist, if you treat lots of inflammatory diseases, you may work with blue light. Blue light has, of all colors, the most pronounced anti-inflammatory effect, but you don't get penetration deep into the tissue. If you want to target inflammation deep into the tissue, you wouldn't get the photons of blue light deep into the tissue. We have, for transdermal irradiation, what we call the optical window. And this covers the colors from visible red to non-visible near-infrared light. So 650, 670 nanometers gets good penetration, 808, 810, 950. If we go in the very far infrared area, the photons are absorbed, and you see in the cartoons, by water. The colors of the rainbow are not harming our body. They induce healing processes. Even if I have a burning, I can use infrared light laser to induce healing processes. However, short wavelengths can attack our tissues. We know from the UVC, UVB irradiation, the body protects themselves against it, and they produce melanin, not melatonin, melanin, the color of the skin, the dark coloring of the skin, the melanin. And this absorbs the UV, and the UV irradiation doesn't go into the deep tissue, doesn't cause any harms. So the absorption, the biooptical window for penetration is fixed by the absorption curve of water, by melanin, by hemoglobin, and other chromophores that absorb or let pass. What laser devices are on the market? Hundreds and hundreds and hundreds of different laser devices are on the market. Very, very simple is the pen. We can combine irradiating 10 points at the same time, or 12 points, then we call laser needle or light needle. We can perform area therapy by different showers. We can perform deep penetration, as shown many times before, with cluster probes. There are different cluster probes available with flexible tips focused cluster probes. We can work non-invasive blood irradiation by laser shower again, by superpulsed knee irradiation. We can put single-use sterile optic fibers into the bloodstream for irradiation. We can go even under sterile conditions deep into a joint to irradiate into a joint space. And we can combine, and this is the fascinating things about photobiomodulation, we can combine photobiomodulation with all other modalities of treatments. We can combine it with physiotherapy, with osteopathy, with acupuncture, with stem cell therapy, with platelet-rich plasma. So laser can be offers the huge variety of different combinations, and in neurodegenerative diseases, in osteoarthritis, we can get fantastic results if we combine, for example, PRP, the platelet-rich plasma, mesenchymal stem cells with laser irradiation. The mitochondria decide about the survival of stem cells, and the right color, the right wavelengths for the stem cells means the stem cell can survive and grow into the tissue in which they were injected. We can combine laser, the power of light, with photosensitizers. Then we talk about PDT, photodynamic therapy. We can use it under certain conditions to treat aggressive cancers. We can use the combination in early stage of infectious diseases. We can perform antibacterial, antiviral photodynamic therapy. And sometimes we need to bring more photons into the tissue. Then we may use a class 4 laser, such as the light stream. If you want to use all the different colors for treatment, a fantastic calibrated device is the Photon Care Germany Moonlight and Starlight device. In this example, you see it works with 2 different red light, non-visual near-infrared light, blue light, and green light. So we really can cover all, remember the rainbow, all the colors of the rainbow. Here another example from my clinic where we performed blue light irradiation, which is not only anti-inflammatory, but has an NO releasing from the NO from the vessels. It's a terrific method in arterial hypertension. And at the it's a couple, man and wife, and the yellow light irradiation in depression and osteoporosis. So we can use any color in any condition. Okay, here in the picture above, you see again the different superpulse cluster probes. But what happens? What's the precise effect on the tissue when we perform photobiomodulation? When a laser beam gets onto the tissue, when I start to irradiate the golfer's elbow, part of the photons are reflected. This is the reason why you shouldn't irradiate from distance, but if at all possible, have contact to the skin. The better the contact to the skin, the better is the coupling, the better is the flow of photons into the tissue. So to avoid reflection, have good coupling to the tissue. Part of the photons are absorbed by melanin, by pigmentation of the skin, by whatsoever what's on the tissue. Typical for laser light, I always call laser light is living light, is the scattering, the spreading. If you see a laser light irradiated on the ceiling or wheresoever, you will see a scattering effect on the tissue, on the irradiated field. And this is almost unique for the laser speckles. We aim, of course, we want to bring the photons into the area where the inflammation is. So we aim for a good as possible penetration into the tissue, and the best penetration into deep areas, even penetrating into the bone, can be performed by superpulsed cluster probes. We achieve in these what we call a blanching of the tissue. With every impulse into the tissue, we get a better flow of photons into the tissue. I mentioned LLLT, photobiomodulation, has a huge variety of healing effects. Where do they start? Well, this is not only complete, it's just an overview. LLLT improves micro and macro circulation. So when we have a better flow of blood into a damaged tissue, we of course better nourish the tissue. We bring better micronutrition. We bring better oxygen into the tissue. So we really get healing effects. Laser has significant anti-inflammatory effects. Why that? It enhances the leukotaxis, so white cells penetrate much more rapidly into inflamed area when they are irradiated with the laser. Pro-inflammatory substances such as prostaglandins are less expressed by the body. We have an anti-edematous effect. Good studies show that photobiomodulation, laser irradiation, is more effective than manual lymph drainage. Macrocirculation, microcirculation, I mentioned. It regenerates tissue. Just imagine, by irradiating cartilage, joint space, we activate the chondroblasts. We bring up new cartilage into the tissue. If we have a fractured bone, we activate the chondroblasts. We activate the fibrinoblasts. So the callus is achieved twice as rapid. The total healing is cut by half. Many regenerative effects. Enhances wound repair. It's the same topic about it. We will go into a little bit detail in a few minutes. If we give laser light, not with the average, I may mention, there will be a slide later on this as well, according to the world, for use of photobiomodulation for promoting healing processes, you roughly need 4 joule per square centimeter energy density, 4 joule per square centimeter to achieve healing purposes. But if I want to have a blockage, if I want to block the C fibers, if I want to block the nociceptive pain system, then I would give a much higher energy density for nerve blockage. Here you see with moonlight, starlight, intravenous green light irradiation, just an example. Summary of what I mentioned before: laser effects, reduction of inflammation, relieving of pain, reduce of itching. Laser stabilizes the cell membranes, pro-inflammatory substances. I mentioned prostaglandin, but as well histamine. We have a less release of histamine. So if we have itching, it will be reduced. Terrific in atopic eczema, terrific in inflamed insect bites whatsoever. Regeneration of tissue, enhancement of micro and macro circulation, lymphatic drainage. And the most important fact, I would say, behind everything is with the laser, we target the powerhouses of our cells. We target the mitochondria. We enhance ATP production. Just imagine, by irradiating a tissue, a myocardial tissue, for example, we can increase the ATP production by up to 4 times. Here is a study where it's performed easily. irradiation in a petri dish of yeast cells, yeast cultures, irradiate, and we have an increase of ATP, adenosine triphosphate, the universal current of energy by 150%. Laser targets on different chromophores. The hemoglobin absorbs green light. But on cellular level, we can very precisely predict, show which antenna pigment, which part of the energy production system of the oxidative phosphorylation taking place on the inner mitochondrial membrane absorbs which color of light. But let's go a step back. Where do we find mitochondria? Mitochondria are all over our body. Every single cell, except the grown-up erythrocytes, every single cell contains of mitochondria. The higher the energy demand of a cell is, the higher is the content of mitochondria. So normally in a lecture, I would give this question now to my students. Where do you find the highest amount of mitochondria? Of course, one of the organs that never sleeps, that has to beat 24 hours a day, is the heart. Therefore, in the heart, you find the highest amount of mitochondria. Just imagine in a healthy heart, more than 1/3 of the volume are mitochondria. I'd like to mention, we briefly mentioned, and this is not the topic for this lecture today, but I'd like to show you the whole variety. We talked about stem cells. Stem cells, pluripotent stem cells, mesenchymal stem cells, have the capability to develop in all different organs, except the uterus. And this means they must have a lot of energy capacity to differentiate and differentiate and differentiate. So in the most pluripotent stem cells in the oocyte, you may find more than 100,000 mitochondria. And even the platelets, the small platelets, the thrombocytes contain 1 or 2 mitochondria. So mitochondria are uttermost important. And the professor who first described acquired mitochondriopathies was Professor Luft from the Royal Karolinska Institute in Sweden. Life is anchored in the mitochondria. I mentioned before, this is beside the laser mitochondrial medicine, my big love, and it fits perfectly together. It goes hand in hand. Most of our energy we need every day for thinking, for moving, for producing hormones, for any energy consuming process. Most of our energy is derived from the mitochondria. By oxygen coming into the earth, we were able to change from anaerobic glycolysis with only producing 2 ATP to aerobic glycolysis with the help of mitochondria. Out of 1 unit of glucose, 1 mole of glucose, with a healthy mitochondria, we produce 38 units of ATP. If the mitochondria are switched off, it's only 2. And by this, it's not only insufficient, but at this maneuver, we at the same time gain lots of acidic substances in our body. We run into the risk to develop lactate acidosis. And another bracket, most of the cancer cell lines switch off the mitochondria and perform anaerobic glycolysis. If you manage to activate the mitochondria again, many of the cancer cell lines go in what we call programmed cell death into apoptosis. I mentioned about the different colors. I mentioned about the power of the mitochondria. Every single cell contains mitochondria. Therefore, photobiomodulation can be used to prevent balding, to treat intracranial mitochondriopathies. Photobiomodulation has shown good reflects in headaches, migraine, in sinusitis, even in thyroid disease, in early stage of Hashimoto disease, in myocardial insufficiency, in asthmatic situation, in COPD, in chronic inflammatory bowel disease, in all forms of neuromuscular diseases, in osteoarthritis. We will see a summary in the end. You see in the lower cartoon, one of the reasons is all these organs need healthy mitochondria. And in the upper cartoon, you see, we nowadays know which antenna pigments absorb which color of light, which chromophores, especially within the respiratory chain, and there is the ATP production. We have the 5 complexes of the oxidative phosphorylation and in the end, the production of ATP. Complex 1, NADH, absorbs at the most in blue light, as well as does the complex 2, the riboflavin. Complex 3, my beloved coenzyme Q10. And in this form, in the respiratory chain, it must be the reduced form of coenzyme Q10, the ubiquinol, which is an electron transport carrier. This absorbs in yellow and green light. And I mentioned several times before, the studies from Tina Carew, for example, the best evaluated, the best established, the most scientific publication have been performed transdermal irradiation with visible red and non-visible near-infrared light. And this is dependent on copper. In the active center of the cytochrome C oxidase, the complex 4, we find copper. Once again, you see we can offer all the different colors for photobiomodulation. Complex 1 and complex 2, blue light, cytochrome complex 3, coenzyme Q10, yellow light and green light, complex 4 and complex 5, red and infrared light. And you see in the lower part of the cartoon, in the end, you see the transformation from ADP, adenosine diphosphate, to adenosine triphosphate with the release of water and CO2. All this energy production takes place in the inner mitochondria membrane. There it's burning hot, and in the upper part you see an inflamed arthrosis, which we irradiated. Were first injected after stimulation. We first injected PRP, mesenchymal stem cells, and then irradiated initially with blue light to reduce the inflammatory situation. Why are the mitochondria so important? Any chronic disease reflects an acquired mitochondriopathy. Good research shows us as soon as 60% of the healthy mitochondria in a tissue in a cell are affected, the cell will counteract metabolic problems. The membranes wouldn't function anymore properly. The exchange of ions is impaired. As soon as 60% of healthy mitochondria are affected in a tissue, symptoms will occur. In some patients, it may be occurring as Alzheimer or Parkinson's disease. In other patients, it may occur as age-related macular degeneration. In other patients, it will occur in myocardial insufficiency. So we can't predict where the mitochondria get weakened first. But in all these degenerative diseases, we nowadays can demonstrate we have a mitochondriopathy, an acquired mitochondriopathy. And the laser nourishes the mitochondria. So with the laser, we really can go in many situations to the root of the disease. When we work with the laser, I strongly advise, think about mitochondria as well. Think about the inborn protection system for the cell walls, for the mitochondria. Think about SOD, superoxide dismutase. There are three forms of SOD. One is manganese dependent, one is zinc dependent, one is copper dependent. So these are three important trace elements to support our first line defense system against oxidative stress and nitrosative stress. And at the same time, if a laser is not working as we are used to it, wow, think of the trace elements. If we have a copper deficiency, red, infrared light don't have proper antenna pigments for the working processes. This is from dear colleague James Correll. He has these Russian dolls. Laser goes onto the mitochondria. Laser goes onto the oxidative phosphorylation on the 5' complex of the inner breeze, onto the respiratory chain. If we properly nourish the respiratory chain, the mitochondria function properly, they bring all the ATP we need. If the mitochondria and the cells work fine, then the tissue works fine. And if we achieve this beneficial effect for all the tissues, we gain health for all of our body. Let's come to clinical indications. What has been reported in different conditions. And once again, not even focusing on these few indications, we can go in details of this. Most detail, I will give an example in the wound healing. But we could have another 2 hours late lecture, or in several countries all over the world, I gave only on pain management a whole weekend. How can the laser be used best for pain treatment? For wound healing, we could have a workshop for over 2 days. So what I will only do, give you some ideas. And of course, this whole introduction lecture is an appetizer. And it's given for free because I'm convinced we really can change medicine. And one of the best things I ever heard was from a colleague from Iran. I think it was 64. And he attended more than 10 lectures of mine. And on a big conference, he told me, Dr. Weber, by you, I learned what medicine is about. I question myself what I did the 3 decades of my medical career before. And I will show you when we look on the wound healing why he said so. He preserved a huge number of amputations. And in the end, I'd like to say, when the students get better as their teacher, then I think the teacher did a pretty good job. Well, we heard about the healing effects of laser. Laser, on the one hand, can stimulate healing processes in multiple ways by stimulating ATP production, enhancing microcirculation, enhancing lymphatic drainage, enhancing repair genes for fibroblasts, osteoblasts, blah. You heard about it. At the other side of the coin, LLLT, can inhibit, as I said in the beginning, negative processes. If I give a high amount of photons into the tissue, I can very effective block the nociceptive pain system, and I can very effective block the C fibers, and then have a lidocaine-like block for the pain situation. And a device that can be used once again is, of course, you will know by now, the super pulsed cluster probe. 300 watts peak pulses altogether, 300 watt peak pulses. It penetrates through the bone. Another choice would be, as shown here in the upper picture, the light stream, the class 4 lasers working with maximum output power of 500, of 15, 15 watt. What we talked about, basically, LLLT, low-level laser therapy, or photobiomodulation, is talking about the so-called 3B lasers, the biomodulation healing lasers. Both can be used for photobiomodulation. Class 4 lasers can be used for surgical indications as well. If we have a class 4 laser with a very narrow, very small surface, then we can use the class 4 laser for cutting. It's much more precise than the surgical metal knife. I can very precisely cut with a high power class 4 laser. And where I use the class 4 laser, I of course cut and destroy structures. I evaporate tissue. But in the near adjacent tissue, I will have biomodulation effects. It's different than cutting with a knife. I do induce healing processes by the use of class 4 laser. But we don't want to talk about surgical lasers. We want to talk about the class 3B lasers and class 4 lasers with a big surface. These are boosters. These are boosters for the mitochondria as well as the 5 fingers, the superpulse cluster probe with the flexible optic fibers is. So laser used for photobiomodulation can be class 3B and can be class 4. It's a question how rapidly I bring photons into the tissue. In any laser you use, I will briefly only touch today. I would recommend not use the laser on a CW, on a continuous wave mode, but use resonances, may call it bioresonances at the same time. We know very well different resonances have different effects onto the tissue. Everything is in swinging, and we can use resonances very effective for additional healing effects that are superimposed to the photobiomodulatory effects. LLT in wound healing, one of the best described topics in photomedicine. What happens when we have an accident? In the first phase, we have inflammation and directly damage of tissue. We have inflammation and necrosis. Then we have the second phase, exudative phase, where we see, it's a watery wound, starting of proliferation. And then we have the regeneration and epithelialization. So on an average wound, we may encounter with a bicycle accident or sports accident, we will have a period of 21 to 28 days until we hopefully get what we call restitutio ad integrum, a total healing. The laser work in any of these situations. The inflammatory process is reflected by leukotaxis, by release of cytokines that bring the leukocytes into the area. But by irradiating these with the laser, we at the same time booster this effect. We enhance the circulation. So inflammatory processes or products, let's say like this, will be brought out of this area much more rapidly. By different pathways, by different mediators such as NF-kappa B, we enhance repair mechanisms. We enhance in the second phase, the proliferation phase, and regeneration phase. We booster the building of elastin, fibrinogen, hydrogenic acid. So we have a huge variety of different effects in the irradiation of impaired wound healings. This is a patient from my clinic who came into the clinic with diabetic ulceration. And you see on the left cartoon, in the end, there were only some discoloration left. How often would you treat in such a situation? Every other day, 3 to 5 times weekly until healing. Of course, don't forget about surgical maneuvers, cleaning of the wound. In this case, we need 15 treatments until it was cleaned. And it worked so terrific that the surgeons around our clinic started to send patients and patients and patients. So quite often, if you get good results in this, you can run your clinic only on wound healing treatments. What can be used for wound healing? You may use a single probe, like shown in the lower cartoon. You can use any form of laser shower for irradiation. The above laser shower gives you the opportunity to combine the different wavelengths. What wavelengths would you choose in an inflamed, poor healing wound? Of course, enhancing, boosting ATP production, red and infrared, would be the best. Red for the superficial part, near infrared for the more deeper situation. But if it's inflamed, you would always like to have blue light in addition to this. So therefore, this shower gives you a good chance to combine on the individual patient, on the individual situation, the wavelengths you need. Another example I'd like to share with you because it reflects, wow, the booster effect on a small accident. Severe cycle accident with even loosening of teeth, not losing, but loosening of teeth. First cartoon, day after accident. On the day after accident, we started with the irradiation, with the treatment. We irradiated the next 4 days. And you see already on day 4, there was no exudation anymore. It dried up. And now really look at day 9. I repeat, look at day 9, less than 10 days. Less than 10 days, everything was gone. You had restitutio ad integrum, not after 21 to 28 days, but by day 9. In this case, we even cut it more than 50% of the healing period. But there are even more severe cases. Before I come to this, I just mentioned one of the few slides on resonances. This study I took from a colleague from Delhi, from India. Resonance modulation makes the difference. They put artificial wounds in the small animal model, treated, no treatment, laser irradiation continues, laser irradiation 8, 10, 10 hertz, 8, 10, 100 hertz, and 8, 10 on higher resonances. By far the best results was with the so-called alpharism, the 10 hertz. And this is one of the universal resonances I'd like to introduce to you. Irradiate with 10 hertz in many medical conditions. It's terrific in neurodegenerative diseases. Michael Humblin from Harvard Medical School could show in the acute stroke situation and in the acute traumatic brain injury. 10 hertz, the alpharism of our brain, brings the relaxation mode into the tissue, brings down the metabolic demands of the cells. And it's the same in the wound healing. So 10 hertz is a good universal resonance. Another universal resonance is the so-called self-healing resonance. the 4625 hertz. All the most important resonances are preset as well in the physio laser that goes with the 5 fingers, as well as in the photon care moonlight starlight. What does resonance mean? Usually I don't, exception, photodynamic therapy, usually for photobiomodulation only. I don't work with CW mode, with continuous wave mode, which is shown in the figure 1, but I would work with resonances. And usually the resonances are defined by, they are always defined by 1 impulse per second. The gaps between may be different. But in the standard resonances we are talking about today, the time where the laser is working and the time where the laser is off are 1 by 1. So if we say here on the time axis, you see 1 second, T1, 1 second, you have 2 impulses in 1 second. So this would be the resonance of 2 hertz. Figure 3 would show you T1, 1 second, 4 impulses in the second, and this would mean a resonance of 4 hertz. So in 10 hertz, it would be 10 times laser on, laser off within 1 second. This would be the alpha resonance. So basically, if you work with resonance, in the same given time, only half of the time photons are given into the tissue. And this is independent whether you work with 2 hertz, 200 hertz, 2000 hertz, or whatsoever. But the additional resonance has additional healing capacities for the patient, as we have seen in the cartoon with the wound healing disorders from India. So I hardly ever work with CW mode, continuous wave. Resonance therapy is enhancing the photoabsorption, is enhancing photobiostimulatory effects, and has additional organization effects onto the tissue. I'd like to demonstrate this with the Newton swing. Many of you will know it from childhood. You take one ball and put it to the others, and all the other balls will swing likewise the first impulse. So resonance therapy and photobiomodulation gives you additional healing capacities. There are hundreds, now there are thousands of different resonances that have been published in the literature. The first one who worked on resonance therapy with light was Professor Paul Noguet from Lyon, from France. One of his, or the most famous student of Professor Noguet was Professor Frank Bahr from Germany, who published many literature, many books on resonance therapy. Student of Bahr, Reininger, is quite often cited when talking about resonances. We know, according to Reininger, that the meridians of Chinese medicine have different resonances. But even long times ago, Rife, Solfeggio, Elias described resonances, some of them mainly in light therapy, some of them in electromagnetic therapy as well. When we go to the first descriptions by Professor Paul Noguet, he said, for example, a resonance of 292 hertz is for acute allergies, nutritional resonance B, 584 would be in chronic disease, supporting the tissue, so you would use it in asthmatic situation, in COPD, in inflammatory bowel disease such as ulcerative colitis. C in muscular impairment, I always say the 1168 hertz is the resonance for the orthopedic surgeons, for the orthopedic doctors. D, psychiatry. E, especially peripheral nerve impairment. F, depression. G, personality disorders. And U, universal resonance, basically would be the heartbeat. 1 impulse per second, 60 seconds, a little bit more. So heart frequency, 60, 68, 72, universal resonance. Okay, I promised you my students are better than I am. This is from a very successful colleague from Iran, specialist on wound healing disorders. And this patient was brought to the clinic for amputation. And within less than 3 months, he achieved these results. You see the bones, you see the tendons, you see the muscles. There was no tissue detectable anymore. By the power of light, they were able to induce this fantastic healing processes. And even worse, this is a gangrene. Wow, I must take my hat. It's so fantastic. It's so fantastic to see these results. This man wouldn't be able to walk on his own anymore with working chair, walking sticks, or whatsoever. They were able to preserve this foot. Laser enhanced micromicroscopy. There's no circulation anymore. There's total lymph blockage. The laser solved it. There is no nourishing of the tissue anymore. There is no ATP production. With the laser, they were able to regain ATP production, of course, with many trace elements in addition. He got high dose of vitamin C, he got copper, he got zinc, he got coenzyme Q10, he got selenium. But basically, without the light, this problem wouldn't be solved. And here again, you see already all the tendons and bones and muscles have been partially destroyed. This is the power, the healing power of light. Another study from a colleague from Tel Aviv, I'd like to share, from a neurosurgeon. Here, performed an animal study in 43 rats. They put a clamp on the ischiatic nerve, and one group was irradiated with a laser, and the other group was control group. So what would happen if you put a clamp? No nerve impulses would be conducted anymore. This is what you would expect. Imagine. They irradiated with a laser, and within 20 minutes, the conduction of nerve impulses was better than before setting the clamp. And this is a phenomenon that is very well described in many, many publications, and it reflects my own experience as well. Especially damaged tissue get the benefits of photobiomodulation even better than non-damaged tissues. Don't damage a tissue before you treat it. Don't misunderstand me, of course. But the power of light especially works when a tissue is damaged, and partially it's explained by those who still can follow me by mitochondrial medicine. In a damaged tissue, the body is not able to produce proper ATP. There is oxidative stress. The complex 4 of the respiratory chain, the cytochrome C oxidase, is blocked by NO, by nitric oxide. By irradiating a damaged tissue with red and infrared laser, you uncouple NO from the blockage of the complex 4. So ATP production takes place properly. And moreover, what does NO do? NO is the most potent vasodilatative substance. So we enhance microcirculation. So we get a better flow of blood into the tissue. We get a better nourishing, a better flow of microtissue trace elements into the tissue. So instead of the downcircling by the light, we bring healing processes in an upgrading process. What you have to know when you start out, I don't want to go much into details. You have to know what is the wavelengths of the laser you use. Is it blue light, 450 nanometers? Is it red light, 650 nanometers? Is it non-visible near-infrared light, 808 or 910 nanometers? I mentioned before, I would always suggest to work with resonance therapy. This is defined by hertz, 1 hertz, 1 impulse per second. You have to know how much photons I have to bring into the tissue, what is the energy density I want to achieve. And this is the most important question you have to ask yourself before treatment. Where do I have to bring the photons? Do I treat superficially? When I have an open wound, 1 to 2 joule per square centimeter is fine. There is no absorption by water, no absorption by melanin. Or do I have a situation deep into the tissue, a huge hematoma, periostitis? Then I have to bring the photons down into the tissue. And then I need a much higher superficial energy density to achieve healing results. Energy density is defined by joule per square centimeter. Children with less pigmentation, with thinner skin, do need usually less energy density for a sufficient treatment than adults. And as mentioned before, take in mind roughly 4 joule per square centimeter are the best energy density for inducing healing processes. This is, I think, and first of all, you see the dog. I not only treat humans, but I treat animals as well. And I can assure you, this is at least as fascinating as treating humans. There is no placebo effect treating animals, and you don't cause pain. Photobiomodulation by class 3B lasers is not a painful maneuver. Quite often, especially once again, my beloved 5-fingers cluster probe, you have shoulder neck pain, you have myoglosis, you use high output of the class 3B laser, you have a photobiomodulation effect on the tissue. I always recommend to do a massage over the muscle. The Chinese doctors would say you do a massage over the gallbladder meridian, you open up the gallbladder meridian, you do flexible tissues, flexible tips, you do fascia massage. So you combine, maybe if you want, Chinese medicine acupuncture, the meridians. You use photobiomodulation. You perform a slightly warming effect on the tissue, and you do fascia massage with one tool, one device only. Well, let's look with a little different, with a little more precise on this picture. As I mentioned before, children usually do need significant less energy density than adults. A white skin gives good penetration, whereas a dark pigmented skin absorbs and needs more energy density to bring the photons into the desired area. Where there is no hair, it penetrates well. Where there is hair, especially dark hair, lots of the photons are absorbed superficially. I don't know in which part of the world you live. Here in Western Europe, as well as in the States, more and more and more of the patients have tattoos on their skin. And this means the photons are absorbed by the tattoos. And this causes warming of the tissue. Then you have always to work with the resonances. I mentioned chemotherapy and radiation therapy. Induced oral mucositis is a problem that was not solved in oncology. In the consensus paper 2 years ago, the interventional radiologists and chemotherapists, oncologists agreed the most powerful treatment is irradiation by red and infrared light. in chemotherapy, radiotherapy-induced oral mucositis, mucous membranes. You have periodontitis, you have after, you have herpes infection. Wow, laser works terrifically. And you don't need much of energy density. Open wound, not much energy. But if I want to target impaired nerves, I need more energy density. Once again, Roshkin could show even if a nerve is cut by an accident, you put a Teflon tube in, and by irradiating from both sides with a laser, the nerves have the chance to rapidly grow towards its other sides. Muscles, muscle fiber rupture, wow, terrific. Bone fracture, I already mentioned. And the highest energy density you need for pain treatment. Area therapy can be performed by the two different forms of cluster probes with parallel beam or with focused beam, according to the clinical condition: infected wounds, diabetic ulcers, Penn's elbow, Gelfand's elbow, hematoma, bruise, bursitis, atopic eczema, psoriasis, and mentioned before, well aging, anti-aging of the skin to bring more fibrinogen, more elastin into the tissue. Here, one example of irradiating in atopic eczema, neurodermitis, inflammatory processes typically in the elbows and in the knee region. You have inflammation, you have poor circulation of the blood. Irradiate with the laser shower. There are many on the market. Left one goes with a physio laser, right one goes with photon care, moonlight, and starlight. You'll get terrific results in inflammatory skin diseases. Sometimes you may combine, for example, in lesion with photosensitizers to perform photodynamic therapy. Probably the best indication, or if you want to work transdermally in osteoarthritis of the hip, in the obese patient, in the knee, in the former Sudeck syndrome, now complex regional pain syndrome with damage of the plexus, you get good results quite often with the 5 fingers cluster probe, arthritis of the shoulders, or omarthrosis, mastoid infection, hearing loss, tinnitus. All these are terrific indications for the use of the 5 fingers cluster probe. Dermatology and cosmetics. We could have a whole week on this topic. Just few slides that already summarize some information I gave you. You may use laser showers just to prevent premature aging of the skin. Just irradiate the different parts of the face, in this case, with a laser once a week, every other week, and you will boost the ATP production. You will prevent metabolic changes in the tissue. You will enhance the building of proline. You will enhance the building of elastin. You will reduce the breakdown of hyaluronic acid produced by our body itself. But even if you are a dermatologist and inject hyaluronic acid by the use of laser, you will reduce the breakdown. If you use PRP, platelet-rich plasma plus stem cells, mesenchymal stem cells, plus hyaluronic acid or without hyaluronic acid, by irradiating with a laser, you will boost the injected stem cells, their mitochondria. They will better grow into the tissue, and you will get a much more pronounced and much more lasting effect in this combination. Balding, hair loss, a terrific indication for combination of PRP, platelet-rich plasma, and mesenchymal stem cells. So in these patients, we perform irradiation, class 4 light stream, or class 3B superpulse cluster probe, which gives good penetrations into the bone marrow. An hour before we harvest the platelet-rich plasma from the bloodstream and the mesenchymal stem cells from the bloodstream, we put in specific vacutainers under strict sterile conditions. We inject the platelet-rich plasma together with the buffy coat with stem cells, and then do irradiation with laser afterwards. And you see one of the fascinating clinical results you can achieve. What's about other fields of medicine? We just picked out few examples on urology and gynecology. In these situations, you may use once again the power of light on its own, or at the best, you combine it with PRP, the platelet-rich plasma again. We get good results in most of the patients with erectile dysfunctions. Of course, if it's primarily by psychosomatic reasons, then the laser and PRP is limited. But if it's post-infectious erectile dysfunction, you'll get terrific results in most of the patients. Another great indication is the strengthening of the pelvic floor after multiple pregnancies, or not moisturing of the vagina anymore. By injecting into the vagina the PRP and stem cells, you get good moisturing of this region again. You may use with specific adapters, as shown in the picture, you may perform irradiation of the sexual tract only with laser, but more powerful in the more prominent situation, you would combine with the use of PRP and stem cells. This will stimulate, as the laser done on its own, stimulate the angiogenesis factors. The growth of vessels will be stimulated. Nerve regeneration will be induced. And once again, regenerate nerves. We would advise, for example, not only use a red light laser or infrared, but use the yellow light laser as well. So there are huge variety of possible indications where you can use the laser on its own or combine with other methods. What's about the huge field of internal medicine? Good studies I mentioned before could demonstrate that from hormonal changes, such as thyroid diseases. These are especially studies from Japan, from Professor Oshira. Early stage of Hashimoto disease, we combine it with targeted use of trace elements, especially selenium, zinc, copper, plus irradiation with a laser can stop the progression of the thyroid disease, of the Hashimoto disease, can stop the autoimmune disorder. Some preliminary studies show good effect in especially type 2 diabetes, or reduce the demand of insulin in insulin-dependent diabetes by irradiating Patients have their beloved injection sites. They get lipid hypertrophy. They get insulin resistance. By using probably, first of all, cavitation and then transdermal laser irradiation, you are almost always able to, first of all, get rid of the lipid hypertrophy, and you break the insulin resistance in many of these patients. You reduce the insulin dependence. Colleagues specialized on diabetic patients report that an increasing number of their type 2 diabetic patients could be taken off any anti-diabetic measurements. But it affects not only hormonal changes. We can use it for COPD and asthma, for cardiac insufficiency. We can use it for inflammatory bowel diseases. So huge variety of internal diseases. One of the first studies, I think it was in 1991 by Mashkalin, a Russian colleague, where he irradiated with a very, very weak intravenous laser device working with only 5 milliwatt. But he could demonstrate in these patients total cholesterol was lowered significantly, statistically significant lowered after 10 times endolaser, blood laser irradiation. Here on the picture, you see red light blood irradiation by photon care moonlight starlight. Vascular diseases, vasculitis, Schönlein-Henoch purpura can be treated by intravenous laser irradiation. Heart insufficiency, transdermal irradiation. And once again, you see the 4-chamber view with the 5 fingers cluster probe. But at the same time, do IV irradiation, immune disorders, allergies. I mentioned in the beginning, especially red light and infrared light irradiation stabilizes the cell membranes, reduces the release of active amines such as histamine. Diabetes, I mentioned a little bit about. I have a huge number of patients with acute and chronic liver disease in which we could, by irradiation over the liver, we could reduce, normalize elevated 10-fold, 20-fold elevated liver enzymes, bring down to normal. Many patients with starting of decompensated, from compensated to decompensated kidney disease, we could bring in compensation again. Elevated hyaluronic acid can be reduced by this method. Elevated creatinine quite often goes back to normal. And now, one of the real challenging things, besides in diabetes, just imagine irradiate 10 times diabetic patients with the insulin resonance. The HbA1c is significantly lowered, but more pronounced is the effect on cholesterol. By irradiating 10 times, we have a significant reduction of total cholesterol, and more fascinating, the anti-inflammatory, anti-atherosclerotic HDL cholesterol goes up, whereas the LDL cholesterol goes even more down than the total cholesterol, just by irradiating with light. Depression, especially the yellow light irradiation, is fantastic. Fatigue syndrome, burnout syndrome. In the patients with COPD, asthmatic situation, in the patient with long COVID syndrome, we do use the moonlight starlight device with green light irradiation. It's not only that green light is a great color for the complex 3 of the respiratory chain, for my beloved coenzyme Q10. But green light irradiation at the same enhances the uptake of oxygen. And even, I think many of you are familiar with the up since, I don't know, 5 years, 6 years, the microbiome, our biggest immune system. By irradiating transdermally or with a specific probe going into the colon, we even counteract dysbiosis by irradiating transdermally or intercolon. We have a good effect on dysbiosis. So there's huge spectrum for photobiomodulation. Yeah, as you have heard by my lectures for systemic irradiation, for deep penetration, I love superpulse probe. This is another superpulse probe, a so-called knee applicator with 150-watt peak pulses. This brings a huge amount of photons into the popliteal region. Of course, it's another terrific tool in Baker cyst and osteoarthritis, gonarthritis as well. If you want to work, if you need to work with different colors, the superpulsed cluster probe works with near infrared light. If you need other colors, a terrific tool is the Photon Care Germany Moonlight Starlight device. Well, I mentioned about the recommendations of the world. No, it's not the world, the recommendations, the guidelines, guidelines of the radiologists and oncologists in radiation therapy induced oral mucositis and chemotherapy induced oral mucositis, especially in head neck tumors. 100% of patients receiving irradiation therapy in neck tumors, head neck tumors, develop oral mucositis. And many of them, such severe oral mucositis that are not even able to swallow their saliva anymore properly. They can't eat. They have difficulties, most of them, difficulties even to swallow their sputum, their saliva down. The world says, or now not the world agrees on this. The consensus paper says there are two options, either to irradiate from outside, and once again, best coupling in these situations is the superpulse cluster probe. I can bring the photons deep into the tissue, or would be the irradiation directly of the mucous membranes of the mouth. One of the very important statements by the world and in this consensus papers is photobiomodulation cannot cause cancer. So even patients undergoing chemotherapy and radiation therapy can be treated with photobiomodulation therapies. But as long as you are beginners, be very careful. Photobiomodulation in a cancer, on a cancer, may in some situation have an effect on the cancer growth. I would be especially not only suspicious, but I would strongly deny, and I would strongly tell you, never irradiate a point that could be a melanoma. Of course, not a melanoma, but once it's proven, but even a suspicious point, don't irradiate with photobiomodulation. However, if I combine the power of light, what we call with a photosensitizer, you have a terrific tool. You have a terrific tool for many cancer situations. What's the idea of photodynamic therapy? And it's not only working for many cancers, it's working for many infectious diseases as well. We have a photosensitizer, usually a natural substances. So it could be, for example, riboflavin, vitamin B2. It could be curcumin, the yellow color of the curry. By giving, let's say, the opposite color of light, so yellow color of riboflavin, yellow color of curcumin, irradiate with blue light, you bring the curcumin, you bring the riboflavin in an elevated stage, and nothing, we don't want to be in an elevated stage. Nothing in nature wants to be in oscillation in an elevated stage. Everything demands to go to a resting into a ground stage. You bring photon energy into the curcumin. And when the curcumin goes back to the ground stage, when the riboflavin goes into the ground stage, when other substances, indocyanine green goes to the ground stage, the energy must put into another area. By a sufficient supply of oxygen, we targetedly induce in the tumor cells free radical oxygen species like singulate oxygen, and this causes only in the cancer cell cellular toxicity. We know from the literature, for example, osteosarcoma take up the curcumin usually 120 times more than a healthy cell. So you make infusions with curcumin, wait for an hour or two, give properly intravenous oxygenation, and then perform intravenous blue light irradiation. Intravenous blue light irradiation, you induce a photodynamic therapy, a photodynamic effect in the tumor cells. We developed a method to perform a targeted therapy. We detect in cancer patients, try to find out early stage. We use progesterone for early detection. More than 80 different tumor cell lines are characterized by an early increase of progesterone. So this can be an unspecific marker for early stage of a cancer. We recommend, once we know it's bronchial carcinoma, it's adenocarcinoma, to perform circulating tumor cells. We get the genetics of the tumor cells. So we know what specific type, genetic type of the bronchial carcinoma, of the pancreatic carcinoma, of the glioblastoma is behind it. Then afterwards, we culture the tumor cells and measure, are they sensitive to any of the traditional chemotherapeutic substances, or are they sensitive to what we call biologica? And then we can perform a very targeted photodynamic therapy, sometimes photoimmunotherapy. And as I mentioned before, tumor cells, most of the tumor cells, switch off the mitochondria. So mitochondrial medicine with dietary advice, with exercise advice, with a targeted use, high dose infusion of trace elements can be a very effective additional tool to traditional oncology or to an integrative approach. This is, for example, one case with pancreas carcinoma, stage 4. He underwent chemotherapy, he underwent operation, he went radiotherapy, and again chemotherapy, and the cancer was constantly growing. We could detect a highly sensitivity to resveratrol, curcumin, artesunate, cannabidiol, and DCA reasonably. So by performing photodynamic therapy with curcumin in combination with infusions, high-dose infusions with resveratrol artesunate, we could bring the cancer into remission. But once again, all this lecture is only an overview to give you some ideas. This is the clinical setting. We give highly purified curcumin. Only purified curcumin is suitable for this. Then we perform photodynamic therapy according to the absorption peak. We always check before we apply the photodynamic therapy, which is the absorption peak, and we will choose according to the spectrometric results. We will work with the right wavelengths, with the specific colors that must always fit to the photosensitizer. Photodynamic therapy only works if you have a good photosensitizer that goes into the tumor, if you have the cooperating wavelengths and sufficient supply of oxygen. Well, unfortunately, my time is almost over. So in the end, I'd like to bring you one of the fascinating topics again. All these are fascinating for me. Orthopedics and sports medicine. Well, this gives you a summary why in orthopedic and sports medicine, photobiomedicine, LLLT is so effective. If we have arthritis, arthrosis, we have impairment of the circulation. So by laser, we enhance micro and macro circulation. We get better flow of blood into the area. If we have long-lasting osteoarthritis, the cartilage, for example, is not properly nourished anymore. By irradiating with a laser, we activate the vascular endothelial growth factor. So we give the tissue the capability to get better nourished again. Microcirculation, macrocirculation, angiogenesis. In all forms, arthritis, we have some inflammation, we have some lymphedema or even water edema. By irradiation with laser, we enhance the lymphatic drainage. If we have additional infectious diseases by bacteria, viruses, fungal, by laser irradiation, we have we have boosted the immune system. We bring the leukotaxis into the area. And once they are in the area, we activate the macrophages. We bring more power in the macrophages to digest and to kill viruses and bacteria. We stabilize the cell membranes, pruritus is reduced. Local nutrition in all arthritis, we need to enhance ATP production. Without enhancing ATP production, we don't get changes in the impaired metabolic situations. We don't give the chance for repair mechanisms. Beside the vascular endothelial growth factor, many other growth factors have been described to be boosted by photobiomodulation. Transforming growth factor, TGF beta, for example, is enhanced. Many repair mechanisms on RNA and DNA level are enhanced. Collagen, we mentioned, elastin, we mentioned. And of course, for those who perform Chinese medicine, you may use the power of light for non-painful light irradiation on acupuncture points as well. If you look into the literature, beside the transdermal irradiation, interstitial and intra-articular irradiation have been suggested, reported in chronic spinal illnesses, in slip disc, in spinal canal stenosis, in scar pain after slip disc surgery, in neural lesion, in deep tendinitis. In many of situations, you may work with the power of light on its own by interstitial irradiation, or you may combine it with PRP to enhance the anti-inflammatory effects, or you may combine it with mesenchymal stem cells, enhance to booster lasting repair mechanisms. In February this year, I had the honor to be invited to an international conference in Seefeld in Austria. I was happy on my literature search that more and more the authorities acknowledge the power of light. I perform it day and day, hundreds, no, not hundreds of times, but over the years, I performed several hundreds of times with terrific results in osteoarthritis of the knee, photobiomodulation. And now with 100% agreement in the recommendation, laser therapy can reduce, especially in combination with exercise therapy, can significantly reduce the pain. So more and more photobiomodulation finds its way into mainstream medicine. I may quote at this point my friend, Professor Mike Hamlin, who just retired from Harvard Medical School. The evidence of photobiomodulation in a huge variety of clinical indications is growing, and you can't ignore it anymore. Nobody knows whether it will be in a year or 5 years. But like an atomic bomb, you can't prohibit that after a while, photobiomodulation will find its way into mainstream medicine in many indications. The color have different effects. Green, we talked about complex 3, ubiquinol in its reduced form, coenzyme Q10. But green light laser has an effect mentioned before for uptake of oxygen to enhance oxygenation in COPD patients, in asthma patients, in long COVID patients, in obstructive or restrictive pulmonary diseases. Good. But another thing I'd like to share with you in this slide is green light irradiate on mesenchymal stem cells enhance the change of the stem cells. They are pluripotent. Enhance the change of the stem cells into osteogenic cells. So we're talking now about neurodegenerative, about osteoarthritis. So this is a good reason why when you want to enhance, to bring osteogenic cells into an irradiated area, you should not only use blue and red, but should combine with green light irradiation. Here, another example from clinic in UAE, in Dubai Healthcare Center, where we treated severe lasting Cox arthrosis. Knee joint you may do just by palpation, knee joint you may do by ultrasound guidance, injection of the optic fiber or injection of PRP with optic fiber, or the whole thing, injection of PRP, hyaluronic acid, stem cells, and then optic fiber. But for Cox arthrosis, you should work with control by ultrasound or by radiation or even MRI. So you see here, after injection PRP and stem cells, we irradiate with blue light. Here another example from grade 3 osteoarthritis patient came in with walking sticks. You see the osteophytes, and after 4 sessions of PRP and stem cells, the patient could walk without any pain, without walking aids. This is now a year ago and still no recurrence of pain. And I have countless patients with similar conditions. And even after years, or in this case, the knee replacement, the TAP, could be avoided. Sometimes the cases are even worse. Here you see severe neck injury where we performed PRP plus stem cells plus interstitial irradiation. Another patient with severe thoracic spine injury where we performed interstitial irradiation. You have to have the best equipment in these severe cases to achieve good results. Well, at the end, what are the contraindications? If you look into the literature, LLLT, low-level laser therapy or photobiomodulation should not be performed over the cartilages until adolescence, because laser can stimulate the growth of bones. LLLT has been performed for more than 5 decades, and not a single report demonstrated that irradiation over the epiphyseal cartilage could cause any change. Directly irradiation of the eye. Well, of course, I wouldn't advise to switch on now the laser device and look, is it working or not? In all the treatment situations, the therapist as well as the patient should use, and in many countries must use by law, protection glasses. However, at the same time, after more than 5 decades of clinical use of photobiomodulation, there is not a single report that with class 3B, not talking about the surgical class 4 laser, that with class 3B laser, damage was caused to any part of the eye. On the contrary, LED irradiation has been suggested by Australian ophthalmologists and researchers for the treatment of age-related macular degeneration. And as you know, in AMD, we don't have anything to offer by classical Western medicine. Irradiation of the testicles, irradiation of the ovaries. Well, are we allowed to do so? We could demonstrate in different studies in collaboration with the University in Bonn, Institute for Reproductive Medicine, that the irradiation of the ejaculate of the sperms did not induce any changes in the quality of the sperms, did not induce increased DNA fragmentation rates. On the contrary, the most often detected diagnosis for male infertility is the so-called syndrome of the immobile sperm. By irradiating the ejaculate, the sperms started to move again. Why? In the tail of the mitochondria, there are hundreds and hundreds in the tail of the mitochondria. In the tail of the sperm, there are hundreds and hundreds of mitochondria. And if you irradiate, they start to move again. So we have a publication as well with a colleague from Iran on male infertility, where we irradiated directly the testicles. And after diagnosis by the urologists, this guy is infertile, no way to treat. He got children. Other contraindications, malignancy, precancerosis. Be careful. But from what we get, I mentioned the study on the intervention, radiotherapy, chemotherapy induced oral mucositis with still ongoing treatments with still persisting cancer cells should be treated. Light dermatosis, patients being, for example, on antidepressants such as hypericin, St. John's wort, you have to be a little bit careful because these are photosensitizers. But light dermatosis irradiated with non-visible near-infrared light with a long wavelength with resonance would even have beneficial effects. Epilepsy. Is epilepsy a contraindication? Well, definitely I wouldn't irradiate with visible red light close to the eye. This would be disco stroboscope-like effect that could induce a seizure. But research could demonstrate that in children in temporal epilepsy treated with 10 hertz, it harmonizes. What is epilepsy? Outblowing of the membrane potential by irradiating with a laser to stabilize the membrane potential. And you may even treat in certain situations. Decompensated heart insufficiency. I mentioned before, the heart has the highest number of mitochondria. So the heart is a terrific tool for photobiomodulation. Come to the summary. Well, this is a light bed in which we could irradiate the whole body from both sides, not with UV irradiation, not for inducing coloration of the skin as you do in the sun studios. No, with using red and non-visual near-infrared light to induce healing process in the long COVID patient, in the post-COVID patient, in the COPD patient, in the severe atopic eczema, in the severe lesion patient, in the severe psoriasis patient. Wow, terrific for treatment. Laser light, I should write, is a unique form of light. It's monochromatic, only one wavelength, and in contrary to all other sources of light, it's coherent light. It's broad in phase. LLLT, low-level laser therapy, photobiomodulation, is a pain-free method without significant reported clinical side effects over 5 decades. Low energy given to a tissue promotes 4 joule per square centimeter healing processes. High energy given to a tissue, 10, 12, 20 joule per square centimeters, blocks the pain. LLLT, photobiomodulation, can be combined with almost all other methods of treatment. We, especially at the European Laser Academy, recommend combination with PRP, mesenchymal stem cells, physiotherapy, and counteract side effects of cancer therapy. Finally, but one slide will come. I am convinced photobiomodulation will introduce to mainstream of medicine. LLT can be easily applied even in infected skin regions. No, it should be. It has anti-inflammatory effect. Many biostimulatory side effects, especially enhancing boostering of ATP by this inducing healing processes, can be not only for significant medical terms, but for regeneration and prevent premature aging processes. It can be used to reduce abdominal fat. LL, low-level laser photobiomodulation, affects every organ. Every organ from head to bottom contains mitochondria. So many diseases can be treated by photobiomodulation or at least supported. Once again, the average recommendation for promoting healing processes, energy density 4 joule per square centimeter. This is the slide of the WORLD, the World Association for Light Therapy. All these are proven by randomized controlled studies, reducing hair growth in the brain, in the central nervous system, good results in stroke, post-traumatic brain injury, Parkinson's disease, Alzheimer's disease, temporal joint disorder, density. Professor Praveen even could show we could induce the new growth of teeth. Mucositis, we mentioned several times. Skin rejuvenation, tinnitus, I mentioned. Shoulder neck pain, good study from Roberta Cho from Australia, published in Lancet. So we are not talking about minor quality journals, really published in good papers. Reduction of heart attack, stimulating stem cells, non-union fractures, lateral and medial epicondylitis, carpal tunnel syndrome. This was the first FDA-approved indication in the United States. Muscular fatigue, laser lipolysis, we just mentioned in the slide before, all forms of arthritis, osteoarthritis, arthritis of the elbow, wrist arthrosis, gonarthrosis, everything. Wound healing we had in detail. Achillotendinitis we not really went into. And of course, laser is a terrific tool for the replacement of the metal needle acupuncture by a pain-free method. The last but one slide, we started out with Albert Einstein as the theoretical inventor of the laser, the photons. He was so fascinated about light, like I am. He said, I will think for the rest of my life about what light is. I hope by this lecture you get your personal enlightenments, you get some ideas. If you are interested to learn more, you may follow us on YouTube. There are two channels. One, Rethinking Treatment. This is not only focusing on photobiomodulation, but talking about mitochondrial medicine as well, integrative methods for medicine, and photon care, which is primarily targeting on giving concepts for the use of light. Some are general available teaching knowledges, others can be purchased for different diseases. Thank you very much for staying with me for this long period of time. Make yourself informed, get further information on my webpage, the EuropeanLaserAcademy.com, or if you have specific interests in buying, purchasing device, if you want to get very, very specific information about technical specifications, about modifications of your device, please make contact to Professor Dr. Zandi from the Medical University in Tehran, a highly experienced medical engineer, specialist in laser medicine, laser medical device engineering. Have a great day. Let the mitochondria shine for the benefit of your patients. Stay healthy. Very best wishes, your Dr. Michael Weber from the European Laser Clinics and Laser Academy, Germany, Portugal, Dubai, Iran, and Turkey. Thank you very much.